Okay, I want to talk a little bit now about photophobia, because one of the things that I commonly hear from people is I'm sensitive to light, so if I go outside my eyes can't handle it. And so photophobia, which is what we're referring to, now this is different than what we were talking about earlier. What I was talking about earlier was photosensitivity. So photophobia is bright light bothers your eyes, makes you squint, you have a hard time dealing with it or coping with bright light, whereas photosensitivity is, again, we talk about those different medications, is when you create a situation where your skin is more prone to ultraviolet induced erythema or sunburn. So they're not the same thing. So again, go back, you want to go back and rewatch that section on drugs that cause photosensitivity. But here we're talking about photophobia, which is, there are nutritional deficiencies. I said keep those nutrients in the back of your mind because it was coming to it, but nutritional deficiencies that can actually cause sensitivity to bright light or photophobia. And again, if we go back to the photosensitivity, there are a number of drugs that can cause that, and many of those drugs that can also cause photosensitivity can lead to nutritional deficiencies that cause photophobia. And so some of the primary nutrient deficits that we know can increase photophobia: vitamin B12, vitamin B2, vitamin B3, and vitamin D. Probably some of the better research on those, as well as iron. But also vitamin A, zinc, copper, vitamin C, and vitamin E for their antioxidant capacity and their antioxidant function to protect the eyes. The eyes require a lot of antioxidant protection. So let's talk about, if you're struggling with going outside because you can't handle the bright light and you're avoiding sun for that reason, you might want to consider the fact that you have some nutritional deficiencies that are contributing to your photophobia. So let's talk about some of those. This is a report published in the NDNR journal. Dr. Nadia, I'm going to mangle her name, Nadia Chiua. But here's what she found. Vitamin deficiencies long been implicated in gradual decline of vision. And in her case study that she reports on, the following case study describes a correlation between sudden temporary loss of vision, blurry vision, chronic photophobia, again, sensitivity to that bright light, and severe vitamin D deficiency. And in this particular case, correcting this patient's vitamin D led to a recovery and an absence of photophobic symptoms. Now that's not the only nutrient that we know that can create or contribute to photophobia. And as you can see in this particular study published in Annals of Medicine and Surgery on vitamin B12. Now vitamin B12 doesn't typically manifest with visual symptoms. It's more common that vitamin B12 deficiency is going to cause neuropathy, numbness, tingling of the legs or the toes and then the hands. Vitamin B12 deficiency also oftentimes manifests as anemia, or specifically macrocytic anemia. But in this conclusion, you can see we suggest promptly identifying and replacing vitamin B12 in patients with optic neuritis, inflammation of the optic nerve, with proven vitamin B12 deficiency to prevent permanent damage to the optic nerve. Patients with B12 deficiency should have a baseline fundoscopic exam to rule out subclinical optic nerve damage. Moreover, patients who present with visual disturbances should be screened for vitamin B12 deficiency, especially the vegan population, because of that increased risk. So again, one of the connections between vitamin B12 and neuropathy is that you absolutely need vitamin B12 to make myelin. It's part of the biochemical need for myelin sheath to be able to produce the myelin sheath over the nerves. So vitamin B12 deficiency can lead to optic neuritis, which can manifest as a photophobic symptomatology initially. So these researchers are saying that you should have your B12 levels checked if you have visual disturbances. Now, probably the nutrient most associated or most well known for causing photophobia is vitamin B2, and this goes way back to the 1930s and 40s. So in this particular study, You can see 1942, okay, several researchers, so this is kind of a summary of some different research. So all these scientists, okay, so here we go. So later, Odin, and Siebel observed a similar condition in 3 hospital patients who were successfully treated with riboflavin. Riboflavin is vitamin B2. The condition was called a riboflavinosis. And then Cruz and et al. Reported the occurrence of superficial keratitis in cases showing other signs of riboflavin deficiency. 9 cases were observed in this investigation, and later the authors reported a further series of 47 cases of superficial keratitis. They observed that the keratitis disappeared in a few days on the administration of pure synthetic riboflavin. In the same year, Hu, working in Shanghai, described the successful treatment of 36 cases of the same nature. So again, this goes back, what I'm trying to tell you is the knowledge that riboflavin deficiency or vitamin B2 deficiency causes a photophobic reaction is probably the most well correlated and connected nutrient deficiency linked to that. And again, if you have sensitivity to bright light, you might consider vitamin B2 deficiency as a cause for that. And it's a very simple and inexpensive thing to do to take vitamin B2. I mean, for pennies on the day, you can take it. Actually, before we get to this one, I want to pull this one up because this was published by the European Food Safety Authority, and this was published as their scientific opinion on the substantiation of health claims related to vitamin B2, in essence riboflavin. And so one of those claims was on the maintenance of normal vision. And so you can see here riboflavin deficiency can cause conjunctivitis with vascularization of the cornea and opacity of the lens. They go on to talk about glutathione is important in maintaining the normal clarity of crystallines in the lens, and glutathione reductase is a flavoprotein that is particularly sensitive to riboflavin depletion. Let's make that English for you. So glutathione, which many of you have heard of, is one of the most powerful antioxidants in the human body. And so when glutathione is in its reduced state, it's a very powerful antioxidant, but what happens is it gets used up, and then what you have is oxidized glutathione. And so think of it like a cell phone. When you deplete the battery's dead and the cell phone won't work. Well, that's oxidized. Okay, so what has to happen is we have to recharge the glutathione. So there's a process by which we recharge that glutathione, and that protein is driven by vitamin B2 or riboflavin. So riboflavin plays a major role in helping your body to recycle glutathione so that you can continue to have solid antioxidant function. So when they're saying here glutathione, and they're talking about how that is such an important element to the normal clarity of crystallines in the lens, and they're talking about a flavoprotein that's particularly sensitive to riboflavin depletion, this is what they're talking about, this correlation between how vitamin B2 is necessary to recharge glutathione. So in finality, the panel concludes that a cause and effect relationship has been established between the dietary intake of riboflavin and maintenance of normal vision. So again, vitamin B2, probably the most common reason we would see photophobia in a person. Not the only reason, but probably the most common. And then we have this on vitamin B3, and so you can see that vitamin B3, also known as niacin. Cutaneous manifestations of niacin deficiency include sunlight sensitivity. So one of the things that happens to these individuals is they can get highly sensitive to sunlight when they go outside. This is not the same sensitivity. This is, or not that it's not photophobia, but it's sensitivity. So this would be skin redness, not the eyes needing to wear sunglasses. So skin redness, again, as I mentioned earlier, there's a difference between photophobia and photosensitivity. But with niacin deficiency, we can get, again, enhanced skin burning as a result of that deficiency. So a lot of nutrient interplay between your ability to tolerate sunshine, both through the skin, nutrients acting as antioxidants, nutrients acting as photoprotective mechanisms to prevent sunburning, but also nutrients behaving with the eyes to give you the ability to go out in the sun and not have to squint or feel like you need to wear sunglasses or just have a sun avoidance behavior all the way around. So, all that being said, we've talked today about the benefits of sunshine, both UV light as well as the red spectrum of sun exposure. We've talked about the disease risks associated with the lack of sunshine and how that is a much greater risk to your overall health than worrying about sunlight exposure in fear of burning to develop skin cancer. We've talked about drugs that can increase your risk for burning. Many of these drugs that are commonly prescribed are prescribed to treat many of the very diseases that we know lack of sunshine can contribute to in the first place. And then subsequently, we've also talked about how those same drugs can cause nutritional deficits that lead to either increased photophobia or increased sensitivity to sunlight, or reducing your capacity to naturally protect yourself from the UV exposure to sun. And so all that being said, hopefully what you're taking away from this is that we need sun. And many people are going out today and they're buying all these different types of box lights, the red lights and even the UV lights for home-based use. And I'm not opposed to those things, but I think you shouldn't look to those technologies in lieu of actually going outside and trying to get natural sunlight. Natural sunlight is free. It's extremely powerful. There are more benefits in natural sunlight even than to just UV lights, as well as the exposure to red and near infrared light. There's a lot of light spectrum. There's yellow spectrum and blue spectrum, etc., that also have known benefits. And so when you go outside, you get all of those things. And I'm sure there will be more that we'll discover as time goes on, more benefits to how important sunshine can actually be. You may live somewhere where you're saying, you know what, I just don't have the ability to be in the sun. If you're in Alaska, or if maybe you're in Russia, or maybe you're at a very northern climate where your winters are long and your summers are short, and your daylights are short, your daylight periods. So, if you have the ability, one of the things you can do is take a vacation, go on a holiday, snowbird in winter months if you can. But if you can't, this is where some of these light therapies can be very beneficial. And what I personally have, and I'm in Texas, which is, in the South, but I still have these devices. I have a red, infrared light box. And just so you guys know, nobody pays me to promote a particular brand. I'm not an affiliate for any of these different companies. That being said, I can tell you the brand I have is Platinum LED. I know that's going to be the next question for many of you, is what brand is necessarily best. But this is one brand of red box that's quite good. And so there's three kinds of light boxes that a person could have. You could have this type for that benefit for red and infrared. You could also have a UV lamp and to get the UV exposure. And so again, not an affiliate with this company, but they make a good light, and the name of that company is called Spurdy. You can look them up online, and they have a lot of different options as far as UV light boxes are concerned. And then there's also another kind of light box that many people will buy. And so again, these UV lamps produce UV, and so go back to all those benefits of UV light. The red produces the red and all the benefits of the red, but there's another kind of box that is common, and these are oftentimes referred to as happy lights. And again, these are all three different types of boxes, so just trying to give you clarity. These happy lights generally have a strength of about 10,000 illuminations or 10,000 lux. And so this is kind of emulative of what you might get if you go outside on a cloudy day. You'll have about 10,000 lux of light power hitting your eyes and hitting your body. These have been used for years in northern climates like Russia and Alaska to stave off seasonal affective disorder or seasonal depression using these boxes. And so a lot of people will use these 20 minutes in the morning, sometime between 9 and 11 a.m. early morning exposure, and the whole, setting this box up about 14 inches away from your face. But these boxes are, generally they're, a couple of feet wide and, maybe 3 feet tall, and you just set them on a desktop and you can turn them on. They don't produce any UV, so they're not going to sunburn you. You don't have to run the risk or worry about that with one of these lights. Now, if you're using UV lamps, the way I use mine in the winter months is I'll use it 3 to 4 days a week. And I'm only going to be using it anywhere from 2 to 4 minutes. So it's not a very long time. I'm just using it mainly on those days in the longer winter months where I can't go outside because it's either raining or there's just not any sunshine to have as a result of the weather. So again, this type of lamp can burn you, so you have to be careful. You don't want to just get in front of one of these and turn it on for 20 minutes and fall asleep and you wake up with a sunburn. And if you're on any of those medications that we talked about, certainly please talk to your doctor about whether or not you're on a medication that will really, really cause a strong photosensitive type of reaction to the exposure, because that might be contraindicated for you in that situation. And so those of you who are in that situation, my advice is have a deeper conversation even with your doctor about what you can do to improve your health so that you no longer need that medication, because avoidance of sun because you're on a drug that's treating a disease that could be naturally dealt with if you just changed your diet or changed your lifestyle, to me it doesn't make a whole lot of sense for you in the long run. So again, but all in all, you need to be aware if you're on a photosensitive drug, you got to be careful about the UV. And then with the red light boxes, I use mine and I do 20 minutes to 30 minutes a day. And that's front and back. So generally 10 to 15 minutes on the back, 10 to 15 minutes in the front. I usually do that after I work out in the morning. Now, what could you do in lieu of all three of these things is you could go outside. So again, I don't want you guys to think that you need to go buy a bunch of boxes and spend, hundreds or thousands of dollars on boxes. Go outside. But if you're in one of those geographic locations where that's just not going to be a possibility, then yes, you might want to consider the use of some of these types of boxes. So again, go outside, prioritize it, put it in your schedule. It's the way I work my schedule. I have light time scheduled into my morning. Spend as much time as tolerable in the sun. Now, everybody has different skin tones, so use good judgment for you. I'm not telling, those of you with red hair and super pale skin that you need to go spend 3 hours in the sun every morning, and, use good logic and use common sense here, but spend as much as is tolerable in the sun, as much time as you can. And again, remember, the longer you go out, the more tolerable you become. That's part of the benefit of sunlight, is you make melanin. And that's the pigment that tans your skin, but it also protects you from future UV radiative damages to the skin. So again, the longer, the more you do it, the more tolerable you are of it. A lot of people look at sunshine the way, some guys look at exercise. The old weekend warrior attribution where maybe the young guy was into football. And then as time went on, and he graduates from high school, goes to college, he's no longer playing sports, and then one weekend he joins a football rec league or a football team, and he plays his hardest, and it's been 15 or 20 years since he's done any training, and he, basically he wrecks his knees and wrecks his hamstrings. Same thing happens to a lot of people with the sun, is they have avoided sun for so long, and then they go out in it, they just overexpose themselves on that first exposure. So again, if you haven't been out in a while, maybe try 5 to 10 minutes and then work your way up. Again, be intelligent about it. Remember that UV exposure also happens under the shade of trees. So you don't have to be in the direct sun. I know a lot of you are worried about the potential for photo damage to the skin and the effect of the aging aspect of it. But generally speaking, sunlight doesn't age your skin. Sunburning ages your skin. So, but those of you who want to be more cautious, sit under a shade tree. You're still going to you're still going to be exposed to UV and to reds and all the other spectrums of light. And of course, again, as I said, consider light boxes if you don't have the capacity to, if you don't live in a place where you're going to be able to do this on a regular basis. So, all that being said, I hope you learned something new. I hope you take this with you, and I hope you share it with somebody that you know, because together You know, we can stop the myth that sunlight and sunlight exposure causes cancer and actually does damage. We need to be spreading the word that people need to be out and getting more sun exposure more frequently, more consistently, using good judgment and common sense. Thanks so much for tuning in.